My name is Garcia. I'm the Director of Quality Child CarePartnerships program with Early Learning Ventures. And you've joined the session for the implementation of infant and toddler class in Colorado Child Care Partnerships. I'd like to give you a little background on Early Learning Ventures. We're located in Englewood, Colorado, but maintain an affiliate network of licensed child care programs across the state. Early Learning Ventures, or ELV, is a Colorado-based nonprofit organization. It was initially funded by the David and Laura Mirage Foundation in 2008 in order to address the operational challenges facing early care and education through the effective utilization of shared services tools. As well as resources aimed to increase operational efficiencies and to strengthen business compliance and increase the quality of services to children and families served in the communities there in Colorado. So since the work initially since 2008 was focused on that shared services approach through two main tools. One, a resource platform that ELV launched in partnership with CCA Global to make online professional development opportunities, trainings available, bulk purchasing discounts, and templates that can be used for early care and education programs, and parent handbooks, staff handbooks, things along those lines. And then also a online data management system for child records, staff records, family records, program data, including food program compliance, licensing compliance, things along those lines, so that licensing, for example, doesn't have to spend as much time on site for monitoring. And so these kinds of things were the focus of Early Learning Ventures for probably the first 7 or 8 years of its existence. And then in 2015, we were awarded an Early Head Start Child Care Partnership grant, so that changed the programming significantly. And we don't operate any of our own child care facilities, but through that grant, we're funded to make Early Head Start services available to 240 infants and toddlers across 4 counties in Colorado. And in order to do that, we partner with 30 licensed child care programs across those 4 counties that include a mix of 17 child care centers and 13 family child care homes. And so pretty even mix there between the settings. And so with that background, I'd also like to get an idea of who's in the room. So maybe just a show of hands if we have programs that are already using infant and toddler that are embedded into their programming or starting to. Be interesting to see. Toddler only? Okay. Thank you. Yeah, hopefully, and if you're just thinking about it, then hopefully this will maybe give you some ideas. And I'd love to hear from any of you. This is our example at this point, and we're still on our continuous improvement journey. So, appreciate the conversation. All right. That was our introduction. We can check that off. And this is the agenda review. We'll jump into session objectives really quickly, and then hopefully cover a little bit of each of the 3 stages of class implementation. We feel like we're still moving along in stage 2, but have some things that we think will sustain us in stage 3, already in progress or partially implemented. But the first thing, obviously, is establishing that baseline, and for that purpose, we'll take a brief look at the evaluation. There's an external evaluation conducted on our implementation of that Early Head Start Child Care Partnership grant that included pre and post infant class and toddler class observations. And so that is referenced in the first objective, taking a look at those implementation results. the class observations as part of the Child Care Partnership Program, how that impacted ultimately our internal capacity prior to establishing coaching relationships, and then probably spend the bulk of the time looking at how the class infant and toddler tools have been used to support the coaching experience for teachers of infants and toddlers. And then depending on time, we can touch on where we are in our attempt to move to stage 3 and what that looks like, what are the next steps. Sure, you'll see this graphic a lot over these 2 days. But establishing the baseline at class stage 1, the certified users, or is it certified observers using My Keystone to establish baseline assessments of classroom quality, comply with Head Start or state level reporting requirements, and identify areas of focused professional development. And I mentioned it's an early Head Start grant. If you're not involved with Head Start, class is not required for early Head Start for Head Start, but that was our choice. We had the freedom to choose our own, the tool of our choice. That's how we decided to do it. Briefly mentioned some of the timeline. We were awarded the grant early 2015. Spent I guess the bulk of the rest of that calendar year recruiting child care partners, getting to know them, making a lot of site visits, learning about their operations and who they serve, and in an effort to try to figure out if it was a compatible program from both ends for our implementation and for the enhancement of what they're already doing, building into what they're already doing, and not necessarily trying to change what it is that they're doing within their communities. I think it would be by late summer that year, we had most of the child care partners on board in a more formal partnership. And then by December 1st of 2015, we had 32 child care partners on board, and we're fully enrolled within that early Head Start capacity of 240 infants and toddlers. At that time, we were also working with the external evaluator, the Policy Equity Group out of Washington, D.C. On this evaluation. This was, they used a pre and post research design. There were 5 pieces to it. The classroom quality was one of those, where class infant and toddler were used. We can look briefly at what those other components were, but as far as the data goes, we'll only look at the class assessment piece. The baseline evaluation involves 61 learning environments. You can see the split between infant and toddler learning environments there. From late 2015 through, I guess, early to mid-January 2016, and then the follow-up assessment exactly a year later, in late 2016, January 2017. And then we actually had, I don't know if Becky's here, but Becky Dennis from Keystone came and offered a introduction to infant class and toddler class tools in each of the 4 communities that we are working within. And that actually didn't take place until the January 2016, so right as that baseline assessment finished. So there was very little exposure to the class tool for those programs leading up to that point. This is a visual of our Quality Child Care Partnership model. And you can see that down the left side of this visual, there are 5 components to this model. There's the business development component, which centers around the use of the ELB technology tools that I mentioned at the beginning, the use of the resource platform and Alliance Core, which is the child management system, or the data management system. And that's the use of that is facilitated through our client support team and the ELB Resource Center. Then we have a leadership development component where we have a team of specialists on the ground in each of those 4 communities providing on-site, in-person support for the leadership at each of those child care partner sites. So child care center directors, owners, family child care homeowners in their leadership or administrative capacity. And that support really focuses on managing the continuous improvement planning process, as well as navigating through the multiple sets of standards that site leadership need to be on top of. And then third is the professional development component, which we'll end up focusing on more today. That involves our coaching program and how class is embedded into that, and also involves supports through coaching and curriculum implementation, authentic child assessment, as well as higher education opportunities through local colleges and gaining, with an emphasis on infant and toddler development, and or CDA opportunities in infant, toddler, and family child care. And the fourth component is family development. It looks a lot like the typical family support piece within the Head Start program. But again, our specialists on the ground in those communities working directly with those families around their family goals and needs, and connecting them to the relevant resources. And fifth is the community development component, which where we have service coordinators in each of those 4 communities connecting families to medical, dental, nutrition, mental health, and disability services as needed, and as for routine screening. And then these are the areas that were involved in the evaluation conducted by the Policy and Equity Group. And you can see it's almost a one-for-one for each of those components to our program. The child care capacity for compliance, what was used for that was a modified version of the Head Start monitoring protocol for that year, and was conducted in an interview style with the leaders at each of the child care partner sites. The child care partner business foundations area for that, the program administration scale and business administration scale were used, all of these pre and post. Child care partner organizational climate for this, staff surveys were conducted using the Early Childhood Work Environment Survey and Early Childhood Job Satisfaction Survey. Family outcomes, family surveys were conducted using the Family Outcomes Survey. And then classroom quality is where the classroom assessment scoring system is used. And then here we have a summary of the class observation data. I guess it's not showing up as well as I had hoped, but you can see you see a pair of bars for each dimension. On the left is more of a lighter colored bar, and that represents the baseline observation for each dimension. And on the right is the darker colored gold is the post-assessment. And you can see that, all that middle bullet says that significant gains in areas that emphasize the ways in which teachers support children's learning and exploration. So you see significant jumps from pre to post in facilitated exploration and early language support in the infant tool, as well as facilitation of learning, quality of feedback, and language modeling in the toddler tool. And it says less evident growth in areas focusing on emotional and behavioral support, but you can see that in those dimensions, the baseline scores were already pretty high. And you can't really tell on there, I apologize, that what that red line means. That was what national averages that they used as comparisons, since they didn't have a lot of data, as I think the infant tool at that time hadn't been as accessible yet, toddler more so. For the toddler study they compared it to, it was says baby faces was the average. That was a early Head Start study that I believe that involved over 200 early Head Start classrooms. And but there was no data for that one included for quality of feedback, so you don't see a comparison there. And then the other one was for the infant tool was a validation study conducted in Virginia. So Teachstone folks might know exactly what that is referring to. But that was what was used for the comparison here without a control group. So as you can see, that was very encouraging to us in terms of what we could build off of to move into stage 2. And so stage 2 being where we would start to implement the use of My Teachstone, more hosted trainings, coach certifications, to address individual teacher development needs and to build a foundation for impactful performance in the classroom. And so these are some of the key components that we saw as a need to get us there. Self-assessments for the teachers, which we can take a closer look at. My Teachstone, we have all of our data housed there and sharing resources between teachers and coaches. The expert coaching you see there at this point was only being conducted on an individual basis on site, and so that is primarily where the sharing of those resources through My Teachstone is occurring. And to see where we're moving to as we get further in. All of our coaches, all of our specialists on the ground have been through and achieved infant and toddler observer certification, so that they can rotate for each other's sites as certified observations, and then use that information to inform their coaching plans from there. We can take also a closer look at how we're documenting our coaching visits in general through our coaching logs. And the Colorado Office of Early Childhood offers a multi-level state coaching credential that all of our specialists are at least at the level 1 coaching credential for Colorado. Now, since I don't have a co-presenter here, and I really hope that I had, and I wish that it were our early education manager, Ty Johnson. And so, since she couldn't be here, I recorded her, and so I'd like to share her with you. She's speaking on the coaching program that we have, since it's so close to her work. I wanted to hear directly from her. Hopefully this works.
Hi, my name is Todd Johnson. I am the Early Education Manager here at Early Learning Ventures. And I'm going to share with you all a little bit about how we approach coaching as an Early Head Start grantee and how we utilize the class assessment tool to enhance our coaching processes. So upon implementation of our coaching model, we utilize a professional development committee that was comprised of our leadership team along with some identified specialists in each of the counties that we work within. We were able to map out our goals and our objectives in regards to what we would like to accomplish for coaching. And as we progressed through our implementation process, we were able to identify the personnel that would also be delivering the coaching, as well as the teachers who would receive the coaching. In order to identify the teachers, we utilize the SOLAR assessment, which is a Head Start supported assessment that assesses the teachers' competencies as they are approaching best teaching practices. After that assessment, we were able to identify the need to plan our coaching strategies in a different area to meet the intensive coaching need for those teachers in our system. what we were able to develop was the teacher learning and collaborating learning communities. These communities are facilitated throughout all 4 of our counties that we work with 240 early head start slots with, and they are facilitated by credentialed and master level, both teachers as well as professional development supporters in our early childhood education community. Within these teacher learning and collaborating teacher learning communities, our facilitators lead in charge of bringing theory to practice for all of our teachers. And then our specialists are able to continue with that support by utilizing the lessons learned in those learning communities and bringing those into the classroom and supporting those teachers around the practice that they do on a daily basis. Now, one of the ways in which our specialists are able to make sure that they are connected with the teachers are actually learning and putting it into practice is the class observations. And so our practice-based approach is really geared around child interactions with teachers. And this is in complete alignment with the class observation tool. The class observation tool is heavily founded in the importance of teacher and child interactions. And it is through those interactions that children develop socially and emotionally to enhance their opportunities for later learning in life. And so our specialists in the designated counties are able to take their training on those class tools and how they implement that observation within each classroom, and then they take it further by observing those classrooms, using the tool, and then communicating with the teachers around what they observe. And so each of our specialists hold a coaching credential, or they are approaching earning that coaching credential. Each of them are certified in the infant and toddler class assessment tool, observation tool, and each of them also participate in our teachers learning and collaborating communities. So they are able to directly take what goes on in those communities, relate it into the class rooms of each of our teachers, and then every quarter, as they're doing their class observations, they're able to highlight the areas of opportunities for teacher practices improvement for our teachers. And so, all in all, during this process, we have learned the importance of utilizing an assessment tool and making sure that we have it as a foundation of our teachers' professional development. And that's definitely something that we will continue to enhance as we grow our coaching program.
Sorry, the timing was a little off, but it wasn't too distracting. But I'm glad we got to have Ty's input. And I wish I could have got the mountains in the background. And so this is the teacher assessment that Ty referred to, if you're not familiar with it. SOLAR, strengthening operations for learning and results. So Head Start tools, they have several of these depending on the role of the staff member. And this particular one has a variety of areas. It's 8 pages long, has several sections on effective teaching practice, different learning domains, the learning environment, and then in the end, there are also some customizable pieces if there's anything for your program or your approach that you also wanted to include. So it's conducted as a self-assessment at the beginning of the year, and then used to inform the development of individual coaching plans. And then again by the coach on the back end in order to continue or further refine that coaching plan. And then this is where we document coaching interactions within the Alliance Core. Again, it's still kind of blurry, but you have your basic data points with date, start time, end time, the provider, the purpose of the visit, and so I wish you could see those, but there is ASQ support, behavior management, classroom observation, coach action plan, coaching agreement, curriculum, expanding infant experiences, facilitated exploration, Head Start program performance standards, what else is on there? Lesson planning, licensing, modeling, whatever their reason is, they should be able to find a category. My Teachstone is on there, and or just if they're focusing on open-ended questions or another, if there's something that they couldn't find. And then they have the same list if there's a secondary purpose for this particular coaching interaction at the bottom there. And then what are the next steps, what are the intended outcomes, and then follow up, what will that look like? And then from there, we can run summaries through a line score on, by coach or by teacher or by site, things along those lines. And then as we look to move towards a stage 3, building institutional capabilities necessary for implementing class professional development across an entire teacher population, and supports ongoing engagement from certified coaches and trainers within an organization. This is what we're looking at there. Ty mentioned the teachers learning and collaborating groups. So those are group coaching opportunities that are conducted right now on a monthly basis within each of those 4 communities. Sometimes there are multiple groups, depending on the community. We may have, in one particular county, we have a larger group of family child care home providers, and so they are, they have separate groups from the group of child care centers that we're working with. And then another one is just such a large geographic area in Garfield County. If you're familiar with Colorado and the Glenwood Springs area, there's a lot of space between the eastern part of the county and the western part of the county, so it just made a lot more sense to pick up 2 different ones there. And so just trying to feel out each of those communities and what works best for the teachers learning and collaborating group coaching opportunities, which then can be followed up by that expert coaching or peer-to-peer coaching in an individual basis. And then, of course, maintaining observer recertification, getting more consistent with our observation frequency and more intentional on how that information is used to continue to inform those coaching plans. Consistently using My Teachstone. In fact, that is now, it's more frequent for our program to use those in those teachers learning and collaborating communities than in those individual interactions. And then those individual follow-ups are based on the individual teacher needs coming out of those group coaching opportunities. And then internal class training capacity, which we do not have on staff at this point. And so train-the-trainer opportunities for observer certifications, and talking to Andrew yesterday about the MMCI, they're making most of the classroom interactions, so hoping to move in that direction as well. So at this point, I'd like to open it up for questions, comments, concerns.
Do you guys have an average right now for your infants and toddlers?
An average,
Like of how they're doing on each assessment, so all the
well, I can't speak to that off the top of my head, other than the data that we had in front of us here from that implementation stage. But we can, we do have that in My Teachstone, but I didn't bring a summary.
And I was just curious because we know there's no national average, so we're always curious to see where, other agencies are at versus, compared to where we're at, and how we set the standard for where we want our teachers to be.
Sure. Thank you.
You had the external evaluator, was that required by the grant, or why did you decide to go with that?
It was not required by the grant. It was just something that we wanted in order to inform the work and to have that kind of objective eye to base that off, to have that baseline from that perspective. But no, it wasn't required.
Do any new partnerships, I have two questions. Any new partnerships come in with the grant, or were those already childcare entities that were in the partnership? And secondly, how did the formed economies of scale that you had support this work maybe differently than you've seen with other grantees?
Let's see, for the first question, all of these childcare partners were new to us in terms of working this intensively with them. They probably about a third of them were already working with us in some capacity as an affiliate using the technology. And let's see, of the 32 that started that first year working in the child care partnership, this year we have 30 child care partners participating, and 28 of them are from that original group of 32. 3 years later, and now it's still pretty even split between centers and homes. It's 17 centers and 13 homes at this point. But we did have 4 from that original group. They're no longer participating and added 2 new ones. And could you repeat the second part of the question?
I'm curious about the fact that you already have this partnership established and these relationships established, and if that supported the work differently than maybe what you're seeing from other Head Start grantees in Colorado.
Yeah, I think so. I think the Early Head Start Child Care Partnership grant in Colorado, we haven't seen it working as closely with family child care, for example. I think it has the specific areas where we already had more affiliates. They were able to hit the ground running more with the technology. Say we had more on-the-ground support already in communities like that, but there were 2 of the 4 where we had no affiliates going into that, and so it was a little slower, I guess there, but it's kind of evened out over the course of the 3 years. Yeah, it definitely made a difference.
Did you have any criteria you used to choose the centers? Like, was there a rubric? Was there any way that you could show why centers are going to were chosen?
Yes, and we actually had an application process. We conducted an informational meeting in each of the communities and solicited applications. We looked at criteria such as infant toddler capacity for one, participation in the state child care subsidy program, because we knew that really that particular grant is meant to work well with that and with the layered funding and support. Participation in state QRIS, the food program, teacher qualifications, whether or not they were already affiliates using the technology. All these things were considered along the way. Yes.
So can you elaborate just a little bit about if there were any structural differences between the ways at all? I know it's early Head Start, but were like in terms of teacher-child ratio, number of children in the group, teacher education, all these aspects. Were there any? Did you have any variability within the program? And also, was it taken into account in the research where these differences? Can you look at like any moderating effect, for instance, where the differences between family-based and center-based and family-based, all these aspects, were they taken into account in the findings? Any differences between the functions of folks?
Yeah, I think that the ratios and group sizes and teacher qualifications, those are two of the biggest challenges going in, for sure. Especially since the large majority of the child care partners are running for-profit businesses and then would have to adjust their group sizes and ratios down to meet early Head Start standards, then, that could ultimately impact their revenue. They're already operating on pretty thin margins. But that's where the later tuition came in, and so we actually contract with them for a range of their infant toddler capacity, not all of it, so that the early Head Start capacity is integrated into all of their infant toddler programming. And so it's finding what is that range that would allow them to come out on top, not just break even. If you, for example, looking at those numbers for a larger program, that might have an infant classroom and 2 toddler classrooms, for example. We would have 12 to 16 early Head Start children at a given time there. And that seemed to be a good range for them to be able to commit to making those changes to their ratios and group sizes.
Is variance to the context, do anything in the research? Differences between the 12 to 16?
Oh, that I can't speak to. Or that versus the center versus the homes, how that played out. Because of course the homes have a different ratio of group sizes requirements at that point. But I guess for the smaller programs, like a typical family child care license, we might only have 2 to 4 early Head Start children there at a given time, with a maximum of children of 6. Teacher qualifications was also huge. That going into the implementation, I think we had maybe 20 out of what we needed was about 140 teachers that would be qualified ultimately.
Yeah,
What was probably the one I was most concerned about heading into it, and I think by the first year and a half of implementation, we had over 90 infant toddler teachers that were meeting those qualifications, and which I couldn't even have dreamed that was possible, and let alone being able to build off of that at that point so quickly.
Does Colorado have a Birth to 5 certification at all for teachers?
They do have a,
Like a bachelor's degree in Birth to 5, early childhood Birth to 5, or is it?
they have a Colorado professional, early childhood professional credential that's multi-level. And it's based on a point system where you get so many for your formal education, you get so much for your experience and your more recent trainings and coursework depending on emphasis, and a new competency component that they're just launching. But there's no infant toddler endorsement for that currently, unfortunately. And so we're still having to dig through transcripts and training and CBA and
Yeah.
Yep.
I'm interested in the educators as well. In terms of your selection criteria, did you do any educator buy-in surveys or intention to change, readiness to change?
Initially with the application from the program administration, we had a staff commitment piece, and then
But who did the rating of that, from the director? Leadership?
the leadership at the site.
Not mine. But that's just me. But I'm also interested in your, I know you said you weren't going to describe it, but your family outcomes survey?
Mhm.
What were the kinds of questions
Off the top of my head, I know that there were, it was more, what kinds of changes have you seen in the programming for your child from your program's participation in this program, and then also parent satisfaction type of questions? But back to your question on the staff commitment.
Okay.
That was the initial piece, and then once they're in, or if they experience turnover, then each of those teachers also participating in an individual professional development plan with that long-term goal that they are agreeing with, working with their coach. And so you have that kind of individual commitment at that point, I guess.
As that relationship
Yeah.
blossoms.
Yeah.
In our project, we used at a couple of points an engagement survey, which looked at things like, do you trust your coach? How diligent are you? Do you feel that this is relevant? Are you stressed out by this coaching? But at all, there were those 5 constructs that kind of related to engagement.
Okay. Thank you. Is that something that you all developed? Or?
We adapted it from the NET study, which was a K-12 study. We adapted it down for early, we encountered it called early learning and care. Sure.
Yeah, that'd be great. Thank you.
You talked about the team that you have that works with everybody. I just want to know what that team consists of. You had the slide about business development, leadership development, professional design. What's the team when you talk about the team?
Well, all of our program team consists of myself and Taya as an early education manager. We have a family support, family engagement manager, and we have a health and disability services manager. And then in each of those 4 counties, depending on the number of child care partners, there are, well, 1 to 4 child care partnership specialists working on the ground. There's 1 county where we only have 1, but we have less partnerships there. And then we have another where there's 4, where we have the highest number.
And do you have coaching loads? Do you have specific loads that you would, like, each coach would be assigned so many classrooms or so many centers? And the next part of that is what's the dosage? How do you set that up?
Yeah, the caseload, it can kind of vary because you might have, in the one particular county, it's such a large geographic area that there's so much more travel that can play into it too. So it's not a one-size-fits-all in terms of, well, 1 person to 5 or so on, or some may have more family child care homes, so less teachers to work with, less environments to work with, and so all of those kinds of things are taken into account. We have, in the largest county, there are 13 child care partners, for example, 7 of which are family child care homes and 6 are centers, and we have 4 specialists there. Whereas in 2 of the other counties, we only have 5 partners, but there's only 1 home in each of those counties, and then 4 centers in each of them. And so we still have 2 specialists. Well, we have 2 specialists in one, 3 in the other because of geography.
Question, our program's going to start with the toddler using class, but I know earlier you were asked if there's averages for the different, and since there isn't, how do you determine who the teacher is doing, like for the preschool ages? We have that cutoff score when we know if she's falling here, then she's doing, but for infant toddler, there's no scores, then how do you assess or give feedback to that teacher?
Yeah, at this point, it is done on an individual basis. If they see a particular need in a certain area, then they based on their scores, not necessarily in comparison to the average. They're looking at kind of individually, but that's definitely an opportunity for growth.
So does it still kind of fall in the same low 1, 2, the mid 3, 4, 5, and then the high 6, 7?
Yeah.
And then if they score low based on that, because we're not an average, you just kind of tell them based on the observation, this is your feedback, because you score low in this area.
Or based on a change in consistency in their own practice. Yeah.
Do you know if they're going to come up with the score or average, or what's the process of this?
I can start to address that.
Oh, sure.
So, and I was, because we've now had 2 questions about national averages for infant and toddler. I'm Sarah, I'm from Keystone, and we're in the process of, we are trying to get data from programs around the country. We do not have national averages. We just don't. But one of the things we've just finished doing last week is putting together a Google form. And you will all be invited as new members of the class community to be able, everyone who's a member of the class community within the next couple of weeks will be getting an invitation from us to submit data. And it will be de-identified data unless you ask, unless you give us permission. But so be on the lookout for that, because like so many of you, we're very interested in knowing what do scores look like around the country. We have a fair amount of pre-K data, but we have a very small amount of toddler, and we really don't have anything on infant at all. So we're really interested in that and hope that it will help inform everyone's practice. So,
Thank you.
thanks, Tim.
And if you, I know that there were some people that were interested in seeing more of the evaluation and that data. And so I can post a link to the map if that would be helpful. And that would have the full evaluation on there.
How often did your observers do calibration and double coding?
The double coding, let's see. I know the calibration so far we only did during year 2, once we actually had the specialists certified. And in year 3 so far we hadn't planned for it, but that's something that you know we want to be able to keep on top of. Double coding is more frequent. Let's see, 2 times a year, but on 20% of the learning environments. Any other questions? This is contact information for myself and Ty. I also have some hard copies of the visual. It's like a giant business card. It has my contact info on it. Okay. Well, we're 7 minutes ahead of time.
You talked about the data system you have and how it goes with information. Do they share any of that with directors or with teachers? Is there other things that you use to share information with readers or teachers if you don't use that? Is that just to track the data?
If we wanted to share what types of things?
Yeah, like any information about the coaching session. So like we'll write up what the feedback was that was given, what the plans for the next visit, and that gets left with the director so they understand what's coming, you know, and what the teacher has planned. But I'm wondering if you use that system to put that information and then it would just be shared electronically.
We do. Their coaching plans are also housed within the system. It's Alliance Core.
That's correct here, so
It is, yeah. I have information here if you want to learn more about it. Do a demo. Well, Thank you all very much for your time.